Morning, Alderman Lopez of the 15th Ward. Thank you for allowing me to interview you during these times of uncertainty. And I wanted to know, everyone wants to know, what is the morale across the city of Chicago, specifically in your ward? How are your constituents doing? How are you doing?
Well, first and foremost, good morning, Rashanah. I'm doing well. My family's doing well. We had a little bit of a scare in my office about 2 weeks ago. One of my employees tested positive for COVID-19. So it kind of sent us all into self-quarantine. We have been working through the shelter in place in the office. So it was the first time in 5.5 weeks that we actually stopped and paused what we were doing because of this. I am thankful to say that he's doing much better. His entire family tested positive, believe it or not. His family member that he contracted it from was a frontline worker in a clinic. And I'll talk a little bit more about that later, but it spread within the family, but they're doing well. I think the morale of the ward is, everyone, as we are now entering week 7, everyone is getting a little bit of the cabin fever. Everyone's getting fatigued by the constant bombardment of the news. Every day there's 3 different COVID press conferences going on, and sometimes they all in agreement, sometimes they're not. So everyone's just, kind of frustrated and fed up and tired of being at home, but they know that they have to do it to be safe. But I think that, we're definitely getting to the point now where my residents who, are, the Black and brown folks that we all talk about, but seldom do anything to help. These communities, West Englewood, Back of the Yards, Brighton Park, and Gage Park, are like ground zero for COVID-19 on the south side. And they're at their breaking point, I think, because, many of the people in those communities are the essential workers that we have to still go to stores to work. Many of them don't have insurance. Many of them were struggling to begin with. And this virus has only shown how weak the social network to protect them was in place before the pandemic and where we're at now. But the resiliency of Chicago is stepping forward. We have people who are helping out from other neighborhoods to help our people get through this. We have our own people stepping up within the communities. So even in our darkest hour, we're seeing some of the best and brightest come forward, and I'm very encouraged by that right now.
How are you addressing the residents' anxiety, their fear? As Alderman, as much as you can, like how are you able to even keep spirits and keep everyone positive?
Well, many of the people in our communities, my communities, are people of faith. So one of the things that I instituted immediately was that despite being a governmental official and the separation of between church and state, I use my official social media platforms to broadcast every Sunday service from every church or pastor within the 15th Ward, so that even though my residents might not be able to go out and feed their soul in church, they could feed their soul in their living room from their own pastors, or even from new pastors if they wanted to give them a try. Because we're trying to make sure that people's spirits are up. Additionally, we've been able to push forward with a lot of social media, Robo Calls, things of that nature, to try and let people know that we have not forgotten them, that they are not alone, and that we are, though separate, we are still together.
That's awesome. To go back to doing robocalls the same way as if you were campaigning, that's actually a brilliant idea, because you still have a lot of seniors who are not on social media, but to use robocall to hear that voice, that probably warms their heart, knowing that you're calling and checking on them.
We early on, we did a mailer to everyone just to kind of give them the initial details on what we had at the time. I sent a mailer out to 16,000 households in the 15th Ward. But as it became more evident that people were leery of mail or anything coming into their home, and rightfully so, because we still didn't know how it was being transmitted, we started switching to robocalls, to text messages, social media alerts, and whatnot. I haven't resorted to TikTok yet, but we're gonna get there.
It's a lot of TikTok videos, specifically challenges. So I hope if you do use it, you're going to use it for actually information. What resources are available to the residents that you're able to give out, that aldermen are able to give out?
Well, we've had The rental assistance fund, which was in the initial stages, we've been actually doing a lot with trying to coordinate with various departments to help our first responders, to help our nurses, our frontline employees, as well as trying to bring to the forefront many of the issues that our residents are dealing with, particularly when it comes to food insecurity and trying to address housing issues, especially as it relates to paying your rent or mortgage. Now, not all of those things are city specific. You know, we can't tell a bank to go easy on landlords so that they can go
Right.
easy on renters. But you know, the more we talk about it, the more that the pressure builds for them. But we really have to start thinking of a long-term strategy, because up to this point, everything that we've been doing has kind of been stopgap, short-term measures just to get us from one week to the next. And as we hear more and more that we might be going through this through the entire summer, possibly even to the fall, we really need to come up with a long-term strategy, not just for people who are unemployed. And I'll use that as a shameless plug to tell our state reps to go back to Springfield and figure out unemployment benefits. But also, how do we help make sure people have food on the table? How do we make sure that they have a roof over their head? I've been personally trying to get the Lightfoot administration to reconnect people's water in Englewood, because as you know, many people in Englewood had their water disconnected either during the Rahm administration or at the beginning of the Lightfoot administration. And though she stopped at 6 months in, there are still thousands of people who can't even perform the simplest of preventative measures, which is washing your hands. So we need to just look at what we can do and push forward with that.
That jumps to a question that I want to bring up. How do you feel the mayor and the governor is doing in handling COVID-19?
I think the governor is doing the best that he can, fighting with a federal government that simply does not support the states. Despite, you know, President Trump saying he's all about state rights and things of that nature, he has completely failed where he needed to help us as a country in order to get the medical supplies, PPE, and things of that nature to the people of this country. Even the simplest things of trying to tell the banks to go easy or to suspend mortgage payments, he has failed on that front. So I think the governor is doing the best that he can with what he's got. I think the mayor started strong, but I think her failure has been to communicate and take in the ideas from those of us on the ground every day in the neighborhoods. You know, you cannot have a cookie cutter approach to the 77 communities of Chicago when it comes to fighting this pandemic. The people of West Englewood cannot respond to this virus the same way the people of Lincoln Park can do it. That is why they have the fewest amount of cases in Lincoln Park zip codes with the highest amount of testing, and we have the exact opposite in 60636. We have among the highest cases with the least amount of testing. So we have to approach things differently. We have to listen to all our partners, and we have to be collaborative and not combative, as we've seen time and again. And I think whether it's Lightfoot, whether it's Pritzker, or even Donald Trump, you know, we have to stop dealing with this COVID for the sound bites for the next election. We have to check the politics and start focusing on helping the people, because right now there are thousands of people dying. I've got 24 people who have died from my ward that I know by name from this virus. I have nearly 50 who have survived or are still dealing with it, and they don't care about the sound bites. They want to see us do something to help them and help their families, which is exactly where all of our focus should be.
Can you elaborate on the disparities that the Black and Latinx community face? And before you answer that, what you just mentioned was very valid with the disparities that happen on the South Side compared to Lincoln Park. Me personally, I had a friend who went to the hospital in a suburb, a predominantly white suburb, Oak Lawn, and you have people who don't take it serious. And her response was, the hospital is empty. And she went to Christ. And I said, well, how many people, the typical person, could get to Christ Hospital? You can walk and take the bus or the train to St. Bernard or South Shore or Mercy. So people don't really understand that disparity. They say, well, I'm healthy, so why aren't I can go, but that's not really the case. It's racial. Can you like really break that down for people who really don't understand that racial disparity and how it's almost like a direct target at our community.
You know, I think people oftentimes try to put our communities in a box to explain our predicament in a way that fits their reality. Their reality is not necessarily the reality of people who look like us. For example, our families, African American and Latino families, generally tend to be generational families. You've got your grandma, you've got maybe an auntie living with you, you've got the parents, and you've got the kids. You might even have a grandkid or two in there. You never know. It's just how we are. We're very generational families. And when you have a generational family with essential workers, with half the household maybe un or underemployed, and probably 3/4 of the household doesn't have insurance, when you have a situation where you have a pandemic, a respiratory pandemic that spreads like the flu, where if one person goes to work and comes home sick, you've now infected 3 or 4 generations of an entire household. And to your point, you can't necessarily just go to the hospital or call for an ambulance to help you, because they might not be able to treat you. Or as we've seen in my communities, you might have a health clinic that says they're doing COVID testing until you show up and they say, well, we're only helping new existing clients.
Wow.
Well, it kind of goes contrary to the messaging that we keep telling everyone, that we're opening testing sites to everybody. And then you're also dealing with the fact that many people within our communities fail to see just how devastating this could be if we don't take the measures and to self-quarantine to protect ourselves and our family. Either they fail or they cannot, because not everyone that is out there in our communities has access to the benefits, has access to the food assistance, has access to all those things. And as we've seen time and again, and you know as well as I do, that we've talked about even before this, the boys on the block who do what they got to do to take care of their families. This is no different. Our people will do what they got to do to take care of their families, especially when you have that crying baby or you got someone you got to take care of. You're going to risk it. You're going to take that chance. And unfortunately, the risks and those chances mixed with the generational families is our undoing. I think the other thing that we have to address too is that in zip codes like 60636, which is West Englewood, 60629, which is Gage Park and Chicago-Lawn, Marquette Park, that area in particular, you have testing sites that have never advertised themselves. One of my employees told me that in the 60629, there was a testing site near Marquette Park, which closed from lack of participation. How do you have a testing site closed from lack of participation in one of the highest zip codes in the city of Chicago? That's a good, that is where the disparity is.
I want you to react to this, because what you're just saying about the protection and our families are going to do what they need to do to protect their family. An image popped in my head. We saw men and guns going to, I'm not sure if it was a state capitol, not here, was it in Washington? And I thought, I was like, okay, they want the government to open back up. They want to be able to work and feed their families. What's the difference between our people on 87th and a Dan Ryan trying to do the exact same thing? That's, yeah. What are your thoughts about that?
Well, I mean, first off, let one of us try to show up at City Hall with an AK-47, and the difference will be very clear to everybody. It's very simple. It's white privilege at its best. And those individuals who were protesting out there as part of the Liberate movement, liberate Minnesota, liberate Michigan, liberate Illinois, they feel that their rights have been infringed upon by being told to stay home to keep the communities safe. I think they even went so far as to equate it as modern day slavery, which apparently they don't know exactly what slavery was, because slaves weren't told just to stay home and be nice. This is not their civil rights movement. Being quarantined, being short of quarantine in order to keep an entire population safe is not a violation of your civil rights. How people are reacting to that is very telling, because you see people grow and be sympathetic to the white community, because let's just call it for predominantly who it is. It's the white suburban communities that are saying, you know, we need to liberate our state. And then you see something like what happened in Galewood, where the house party of 1,000 people, and typical West Side, first reaction everyone had. You see what happened on 87th and the Dan Ryan, where the cycle club was there, the riders were there. You know, everyone is quick to start bashing the Black community as being irresponsible, not taking it seriously. But again, silent on the liberation movement, silent on the Hasidic Jews who were in Skokie or Rogers Park celebrating the life of a rabbi who passed away there, completely silent on the 2,000 Hasidic Jews who showed up in New York for a grand rabbi's funeral, but yet we continue to demonize the Black community for doing what you said, which is no different basically than the others, which are people who are doing the same thing, only we're not doing it with guns. So I think it's the negative oppression that continues even in this state, when we should be focusing on, y'all need to just go home. Black, white, brown, other, go home.
What would you like to see the state legislators do, the governor do, if he was to call them into session? Because they're, correct me if I'm wrong, they're not, their session is now, but they're not in session.
Correct. What I would love to see our state legislature do is to get back to work. Start addressing some of the issues that we're dealing with, because right now you have the governor who's kind of doing the major lifting all on his own, which there should be some democratic involvement in a democratic process involved in this. And you need to start addressing many of the issues that we're seeing in the city and state that are failing to be addressed. First and foremost, unemployment. They've got to figure out how to keep that fund operational while we figure this out, because more and more people are now filing for unemployment. The PPP program, the payroll protection program, which is for small businesses, that has been a fiasco from the federal government from the very start. The state needs to figure out how to be the gap between. And you can't do that if you're not meeting, if you're just sitting on the sidelines, or if you're just hoping that Chicago and the governor handle everything. There are 117 of them in the state house, and I think 56 of them in the Senate. Get to work for the people that you're elected to do. Figure out what we can do to help with housing, come up with some grants for housing assistance. And you know what, to the point for our brothers and sisters in southern and rural Illinois, if there is a way for them to open because they are not nearly as dense or in close communication or contact with people, right, then answer their questions too. Let them deal with their issues regionally, because obviously Chicago's region and the southern Illinois region are not the same, but we need to start having conversations, and we need to start having the elected voices of the people in Springfield talking, because once all of this is over, we still have a budget that they're going to have to rework. And I don't think that the people of Illinois will be happy to have a special session called for them to come back to work when the general session ends and we have to pay them more money when they've done nothing for the first 5 months of this year.
How are you feeling as an alderman in these uncertain times? How are you able to, do you feel like you're able to really successfully run your ward? How are your colleagues doing?
Well, I think from what I've gathered, a third of my colleagues have been open in some fashion, like we have been open but not accessible to the public, still taking phone calls, still being resources. I think about a third of them have completely shut down operations and done just work from home kind of things. Me personally, it has been a chance to reinvent ourselves, to evolve and be adept at our new reality. For example, we are still maintaining and monitoring city services throughout the ward. Since we are not having people come to the ward offices, my staff now go out daily and survey an entire community in one day. We're averaging about 200 city service requests a week that we're identifying, whether it's potholes, streetlights. We're working mixed hours and being able to be adaptive because while unfortunately we don't have the foot traffic in the office, it gives us the flexibility to start thinking outside the box a little bit, dividing shifts and things of that nature, so that we can at least maintain the quality of life in the neighborhood, so that once people come out, it doesn't look like a war zone that's been forgotten about. We've still been able to do the work of the residents, even maintaining ward night where people are able to call in. I'm trying to find a way to see what we can do to have more interactive face-to-face measures like this with residents, because I think that it's important still that they know that they can have interaction with us. But thankfully, many of my residents have always had my cell phone number, so many of them have been texting or calling me just to see how I'm doing or just to let me know what they need. Many of them we communicate through social media, Facebook and whatnot. So we have not lost touch with our constituents. But all that being said, as an alderman, for me, it is very difficult to see so many people who I wish I could help, but we simply don't have the resources locally as an alderman to do it. The need is great. The ability is not, to successfully meet everyone's challenges. And it's more like we're dealing with a triage unit, trying to find who's the most at need to help to get them from one week to the next. Last night, my staff and I were out until 9 a.m. delivering groceries that the good people of Bronzeville donated to individuals who did not qualify for food benefits. So we were able to provide much needed groceries to them. But that was at the end of it, a 12-hour day for me. Not arguing, happy to do it.
Yeah.
But I wish there was a better way that we could figure out how to connect people to resources, and in a way where we could do it globally as opposed to having 50 chiefs trying to figure it out, because I am getting calls from other wards. I am getting people who are saying other things. And, we've always kept our doors open, but given first opportunity to the local alderman.
Right.
But it's becoming even more of a challenge now.
Are you all able to, are you distributing masks?
We are, thanks to the generosity of Dr. Willie Wilson, we have masks that we've been able to get for the people of the 15th Ward. My husband actually was creating handcrafted masks for
I think
our
I saw
seniors.
that.
So,
Awesome.
yeah, it was on Block Club Chicago. We were able to he was able to make an initial about 250, 300 masks for our seniors. So our senior home, able to get them to our seniors who needed them at the very onset. Dr. Wilson provided us and many other aldermen with the mask. We've delivered, I think now, almost 1,000 masks out the door to the residents of the 15th Ward. We've actually asked our residents to call in because we want to make sure that my residents are the ones that get them.
Absolutely.
My fear about doing like a public event is that it's hard to say, show me your ID when you've been standing in line for an hour for a mask. Or if I'm not checking IDs, I really have no idea who's getting them. And Dr. Wilson and I both agree that these have to go to the most vulnerable, the seniors and the essential workers and people in the community. And our residents have been very patient with us. We've been delivering masks like crazy to families every day since we got them. So we're getting them out there.
I saw in the news that there was a testing center that opened up. Is that your ward on 51st? I should know this. Don't judge me. 51st and Ashland.
That is actually in the 6th Ward. Access Health.
Mm-hmm.
So yes, Access Health has been open for about a month to do testing in the New City, Englewood area. But then again, that goes to the problem that we're discussing, is that there are resources out there, but you just heard about it yesterday. They've been functioning for a month.
Why is that, and how can we, even as a resident myself, address that, check that, because that's the disparity that we face. What can we do how can we address that?
Well, I think part of the reason why I think it's important for aldermen to be involved in these conversations, and as you know, there was a little bit of a kerfuffle at the last city council meeting between aldermen and the mayor about emergency powers and things of that nature. But aldermen need to be in the room so that when you have situations like this or testing site that's open, but not accepting people or being known about. We are the front line to have those kind of discussions and raise the alarms. And this location in particular is not unique. In the Brighton Park community at 47th in California, there's a multi-million-dollar health center that just opened a year ago. They as well had been functioning as a testing site for about a month, and nobody knew anything about it except for their existing patients again. So, trying to work with Department of Public Health, which obviously is inundated with everything that's going on right now, but working with them to identify where our assets are, where our partners are. And not all partners are city partners. I think that's important to note. Not all partners are city partners. But where they are, how do we coordinate that? And we have to come up quickly with a coordinated schedule of what's available in a community, as we would with any other kind of social service, whether it was homelessness, food banks. You and I both know that we've seen plenty in our community where you'd have a list of what's available, what day, what time.
Right.
We have nothing like that right now when it comes to testing sites. So you really are at the mercy of whatever you Google or whatever happens to be on your feed at that time.
Wow. As we wrap up, what do you believe the new normal will be for City Hall, for you as an alderman?
Well, I think
post-COVID.
Well, I think definitely, what I want to be part of the new normal is I think that we have to get back in touch with the people that elected us. We have to be able to find a way to communicate and to allow people to not only participate with aldermen locally, but with their government. Right now, committee hearings and, our testimonies limited to 30 minutes. We only let 30 minutes worth of public discussion take place, which is an unprecedented shrinkage in the amount of access for the people of Chicago. Mr. George Blakemore can go on for 30 minutes on his own, and now we're just saying, no, that's it on any given day. No one's allowed to meet with us, or even watch. It's very difficult and different universe that we're in. And I hope that we can find a way to bring some normalcy back to that realm. One of my colleagues and I were talking about maybe we don't meet in the chamber anymore. Maybe we find a new venue, an auditorium where we can,
Right.
socially distance, but still be open enough to have a conversation and maybe put people in a balcony somewhere to listen to it. We have to find a way to make this work. And I don't know, even listening today, what the new normal is going to look like, because as we talk about normal for politicians and government is one thing. What do you do for restaurants? What do you do for bars? I heard this morning that Starbucks is pulling out all seating inside their stores.
Wow.
Because they will no have in-store seating. That's going to be what normal starts to look like.
Even the schools. I just, thought about schools. I remember when I was in school, it was 3 third grades. It was 3 fourth grades. So, wow.
So you're going to have schools where does remote learning now take precedent if you're in a classroom with 35 kids and you are 3 feet in all directions as opposed to 6 feet for children? What's that going to do for our teachers? How are they going to be in a classroom that doesn't exist anymore? There are going to be a whole lot of changes to the new normal, least of which is how we interact with each other personally and how we deal with things. And I think that as a city, we have to show, if we have any hope of an economic recovery, we have to show our resiliency in dealing with this, because I guarantee you, whether it's called COVID-19 or something else, this will not be the last time we're in this situation.
Yep.
We have to show that Chicago knows how to handle it. And we do know how to handle it. We just have to show it so that people know that Chicago is a place to bring their business, so that we can hire people from our communities, so that we can start addressing the issues finally, because no one can say there's no inequities anymore. It's as plain for the world to see, but address them all and then show what our character truly is.
Final thoughts from you to your constituents.
My final thoughts to my constituents are, you're not alone. As cliche as it sounds, you and your family are in our hearts and prayers. We love you. We'll do everything we can to help you get through this. But more importantly, take care of yourself. If you can help someone, help someone. If you need help, let us know. But definitely Do not be afraid to have those conversations that many in our communities have skipped for far too long. Talk about your health. Talk about how you're feeling. Talk about you. Because ultimately, once we come through this, you'll be all the better for it.
Thank you, Alderman Lopez of the 15th Ward. Stay safe and continue to, govern the 15th Ward. I appreciate you and thank you again for this interview.
Shannon, stay safe to you, your family, and to all your viewers. Thank you.